My name is Holly Keckler, and I am the Associate Director of Recruitment for the College of Pharmacy, as well as an academic advisor here in the college. With me tonight, I've got three great panelists, and they are going to be here to answer your questions and speak to you about what life is like in the College of Pharmacy and some of the experiences that they've been going through. So at this time, I will turn it over to our panelists. I'll let you guys introduce yourselves, say where you're from, and what year you are in the program. So Emily?
My name is Emily Buatois. I am from St. Louis, Missouri, and I'm a second-year professional student in the Doctor of Pharmacy program.
Great.
And I'm Rachel Wenning. I'm from a tiny town in east central Indiana called Cambridge City. I'm impressed if any of you know where that is. And I'm also in my second professional year.
My name is Sarah Leidy. I'm from South Bend, Indiana, and I'm in my second year of pre-pharmacy.
Okay, great. So why don't we just start off talking a little bit about how you got into
So for me, it was kind of a process throughout high school. I had the same teacher for honors chemistry and AP chemistry. And in the lab, I was always super interested in what was going on, but also in helping my peers and kind of communicating, always working with my lab group. So my chemistry teacher pulled me aside and said, hey, if you really like chemistry, pharmacy is a great way to integrate your chemistry knowledge and that science background with working with people.
Good.
So that's kind of how I came to be.
Great.
I took a little bit of a circuitous route, you could say. I always knew that I wanted to do healthcare. My mom was a nurse. I was always that kid that had a first aid kit and my tennis bag and stuff. But I was very firm that I was not going to do pharmacy because I have my eldest sister and then one of my two brothers actually are both recent graduates of Purdue in pharmacy. So I was very set. I'm not going to do pharmacy. I don't want people to say, oh, you're going to be like them. So I job shadowed 5, 6 different healthcare professions. And my mom's in the background maybe you should try pharmacy. But no, Mom, I'm not doing pharmacy. And then finally, after not really enjoying those job shadows too much, I gave in, job shadowed at a pharmacy, really enjoyed it, decided to come here to Purdue for pharmacy, still not totally set. And actually, my second semester, I took an undecided course. And that was kind of the nail in the coffin. We took this 200 question survey, and then it matched us with a career out of a list of hundreds of careers, and my top match was pharmacy. And finally, after all these different things, after enjoying the classes and job shadowing, I finally realized that pharmacy had caught up with me, and it's really where I wanted to be.
Great, great. So it's definitely a family tradition
Definitely.
in your family, so great.
Mine's actually kind of silly. In, I would say, 6th grade and middle school, we had a kind of event where you would pick a career out of a hat, and you would kind of look at that and see, oh, how would that change my daily life and things like that. And I picked out pharmacy. And then as I started taking classes in middle school and high school, I found that science was just really kind of my thing. And then I started job shadowing, really falling in love with the career and seeing how many different options that pharmacy has, and that's really what got me into pharmacy.
So you actually kind of started off here in pharmacy by just pure chance, just by literally a draw of a hat. That is pretty amazing. Well, it's worked out really well so far. That's great. So please feel free to send in any questions that you might have about the pharmacy program, questions that you might like to ask our students, and anything that might be on your mind. We'll take any questions that you are sending in right now. So during that time, while we're waiting for questions to come in, does anybody want to talk about maybe what they're thinking about for the future? Where do you think you might end up after graduation? Is there a particular area of pharmacy that you are, at least today, this week, that you're interested in? Emily, what about you?
For me, I'm thinking about pursuing a residency after graduation, which isn't required for pharmacists as it is for physicians. But it's something that if you want to specialize or pursue a job in a hospital, typically that's something that you'd like to have under your belt. So I'm definitely thinking about a clinical role in a hospital or in an ambulatory care, more outpatient setting. But I'd also like to come back either to Purdue or to another college of pharmacy as a faculty member and a teacher someday.
Okay. Can you go a little bit more in depth of what is a residency? Because I think kind of like what you said, that's not just for physicians. So how does a residency fit in as far as a pharmacist goes?
Yeah, so a residency for pharmacists is typically 1 or 2 years. The first year is very much a general practice, sort of a continuation of our last year of pharmacy school, which consists of 10 one-month rotations at various practice sites. So your general practice residency the first year just exposes you to a lot of different areas, maybe cardiology and oncology. And then the second year you can choose to specialize in one of those areas if you'd like.
Okay. And then you mentioned more outpatient care pharmacy. So what would that entail? What would that be like?
So for an ambulatory care or outpatient type of setting, let's take an example of a patient with diabetes. So if the physician has diagnosed a patient with diabetes, they're largely going to be managed with medications, insulin being one example there. And a pharmacist is really the practitioner that's best educated to adjust the doses and everything and manage those patients. So instead of going to see the doctor every 3 months, they might come in to see the pharmacist and make adjustments to their medications that way.
Okay, great. Thank you.
So if you'd asked me this 6 months ago, I would have said it depends on the day. And it still does to a degree. But throughout the past few months and working in an IPPE, which is an introductory pharmacy practice experience, I did in January through the college. I did it actually in a local Meijer store. I realized that I think what I want to do is community pharmacy. So those are the ones that maybe we more so think of pharmacists who you see in the different drugstores and your CVS's and your Meijers. And I've come to realize through lab, our professional lab, where you get to do things that a pharmacist would really do, and through my different interactions, that what I really want to do is be able to work directly with the whole population and the patients, and not necessarily know what I'm going to see day to day, and be able to help people with all kinds of things. And so that is kind of what has led me to think more of a community route. I'm going to do an internship with Kroger this summer, and hopefully that'll clear things up a little more if this is for sure what I want to do, or maybe want to stay open to other options.
Sure. And I think there's also probably a big difference when you are thinking about community pharmacy. There are certainly high volume stores and there's low volume stores, and depending on what you like in your personality, some people probably really like the high volume stores where it's always action, it's always moving. And then there's probably some people that like the slower volume stores where you get more time to spend talking to each patient and getting to know each patient. So I think you'll probably have some time to explore that as well.
I'm definitely, at this point, I'm leaning towards the latter. I really appreciate the more clinical aspects. I think that community pharmacy is moving in a more clinical direction. And so that excites me, and I think those are some things I'm going to enjoy. And I think Kroger also is going to do a lot of opportunities in my internship to do all kinds of different clinical things that you don't really think of pharmacists doing, that we're actually starting to do.
So can you give some examples of how you can use some of your clinical knowledge in a community pharmacy setting?
Absolutely. So one thing that we're starting to do more and more is something called MTM, or medication therapy management. I actually did a little bit in my rotation. I think I'm going to do it. I definitely know, actually, I'm going to do it this summer. And that's where we sit down with a patient and they bring in all of their medications, and if they have them, their lab values and all kinds of different things. And as a pharmacist, you go through their whole list of medications and you make sure that they're the right medications for what's going on. They're the right doses, that they're not interacting with each other. And then you actually talk to the patient. You check in, you see if they're having any side effects, if their therapy is working, if they have any concerns or any questions. So it's a really comprehensive review of their medications and their therapies, which is great because, as Emily said, knows medications as well as a pharmacist. So it's a really cool new opportunity to get more involved in a clinical side and in treating the patients. And if you have any questions about it, or if you think some things need to be changed, you communicate with their doctor then, and you work together and get their therapy to the best that it can be.
Yeah, and I think both of you are really demonstrating that pharmacy is so much more than just putting pills into a bottle. There really is so much more depth to the profession. So great. And Sarah, second year pre-pharm, you've still got a little ways to go, but what are you thinking as of right now?
I actually kind of have something specific at the moment. I would also like to do a residency, but I think infectious disease would be really cool.
Okay.
Throughout my schooling, I've really found that I like my microbiology classes, my immunology class, and that has kind of led me towards that. But obviously, I haven't taken some of those certain classes or been on those certain rotations, and I know a lot of people will switch what they think they want when they get into professional school, so I think that'll be a big deciding factor.
Okay, great. Well, and I'm glad you brought that up, that you know that there's a good chance that you may change your mind. And Emily and Rachel, since you're a little bit change your mind, has it been certain lectures or certain classes that you've taken, electives? What has kind of led you to change your mind throughout the time?
Go for it. It's all you.
Well, I guess I've changed my mind a couple different times. I had the opportunity to work at Walgreens for a couple of summers throughout my pre-pharmacy years and even my first professional year of school. And I really liked that. I love the patient interaction. But I also job shadowed in a hospital during my pre-pharmacy years, and I really liked that the pharmacist was involved with the physicians in making treatment decisions, and so I sort of switched to that for a little bit on the inpatient side. Sure. And then I did a couple of more job shadows on the inpatient side and realized it's really cool that the pharmacists get to talk to the doctors, but oftentimes it's in a little huddle, maybe outside the patient's room, and not that one-on-one patient contact. And that teaching aspect of helping people understand their medications was something that I realized I really liked. So then I switched back over and thought, okay, community. And then I found out about ambulatory care and some of our faculty members who practice in that setting, and kind of thought, well, maybe that's the direction I'll go. Okay. So like Rachel, I have an internship this summer at the Mayo Clinic in the outpatient side of things in ambulatory care. So hopefully that'll help me get experience in that area and decide for sure whether or not that's the place I want to be.
Okay, great.
So I kind of changed my mind about every day for my first 3.5 years being here. Even when, first it was on pharmacy and now it's on what I want to do in pharmacy. And I can't tell you why for sure. It's just some days when I thought about, certain pharmacy jobs, they sounded more appealing than others, I suppose, or I thought about different aspects of them. But the two things maybe that steered me towards community pharmacy more were actually, one of them was the professional lab, like I talked about earlier. I realized through the professional lab, which is a little different from other labs. When you think about labs in college, it's not like test tubes and beakers. The professional lab is where we get together every week for 3 hours, and we actually do things that a pharmacist would do. So our big class, once you get into pharmacy school, is therapeutics, where we learn about all the different disease states and how to treat them. And then every week in professional lab, we talk about, and we do cases, and sometimes we meet with patients on whatever the corresponding lectures are in therapeutics. So I realized in professional lab, as I was, doing these things that a pharmacist would do, that what I really enjoyed was, talking to patients and getting to interact with them and getting to, teach them all kinds of different things and handle different problems. And so that definitely steered me more in the community route because, like Emily said, hospitals sometimes is awesome that you're part of like the healthcare team and you have a huge say in the treatment. But I kind of wanted more patient interaction. And then the other thing that steered me towards community was elective, that's the word, that I did last semester, which was a community elective. And it was really neat. They had different pharmacists come in, from many of them, most of them Purdue grads, from all different areas of Indiana that are practicing in community pharmacy. It was really neat to see all the different things they're doing in community pharmacy, and all the different neat programs and opportunities and things that I hadn't even really thought about before. And so that kind of steered me in that direction also.
Okay, great, thanks. Audience, please feel free to type in any of your questions, anything that's on your mind. Like I said, tonight, we've got a great panel tonight, and they're happy to answer any of your questions. But going back to our panel, Emily, one of the things that you talked about earlier was really kind of your passion for teaching, and so you're going to be able to kind of carry that on in your professional life and in your professional career after you graduate. But you are doing some teaching activities now as a pharmacy student. Do you want to talk a little bit about that, how you're able to teach and continue on with that, and how you're able to share that with others?
So I have had 2 separate teaching roles on campus so far. The first one I'll describe a little bit. It's with the Supplemental Instruction Program, which comes from our Academic Success Center. And the Supplemental Instruction Program, I'm going to abbreviate it as SI, is a program that allows students who have done well in the course or a similar course to be student leaders. And we hold 2 evening sessions per week. It's totally optional for the students taking the class to come to those sessions, but it's the leader's responsibility to create different activities for the students to do. We played, for example, tonight at my session, we played Who Wants to Be a Millionaire for their exam review game. So I just assigned a different dollar value to each of the questions, and the students earned their money that way. So it's just a different way to present the material, and for the students who are often freshmen in really big lecture hall classes, 400, 500 students, it's a really nice way for them to come in and work with their peers in a smaller group setting. And then from there, I'll kind of switch to my other teaching role, which has been as a teaching assistant in the organic chemistry sequence for pre-pharmacy students. And so I'll kind of allude to the fact that Sarah was one of my students, and that's been really neat because I can mentor those students, not only helping them with their organic chemistry material, but also helping them through the PharmD application process and just sharing with them my experiences in the program. Our professor who teaches organic chem is also fabulous. He's great. We do each week on Friday, it's a flipped lecture, so the students will watch the lecture material as a video online, and then Friday when they come into class, it's all problem-solving session. So the TAs are there to help the students work in their groups and solve the problems. And as a teaching assistant, since I have an interest in teaching, Dr. A, our professor, has been really fabulous in letting me help design those problem sets for Friday and giving me experience as on the teaching and how to run a course side of things.
And almost developing at least part of those lectures.
Yeah.
That's great. That's great. So Sarah, you are also an SI leader. Why don't you talk a little bit about your experience, and then could you also talk about what was it like having Emily, and this is really kind of just by chance, but what was it like having Emily as a TA and kind of having an upperclassman mentor and yet TA at the same time? What was that like?
Well, first of all, SI has been such a great experience for me. I would say it has taught me a lot of things that I think are really important in a pharmacist role, as far as just getting up in front of a group. I know that was something I was really scared of doing until I got used to it, sitting in front of like the lecture hall, telling them like, oh, this is what we are, this is what we do, and then going and sitting in front of a group of like 20 students and really just trying to help them out. That has really changed how I look at like big group situations. I would also say it's taught me to educate others, which I think is really big in a pharmacist role.
Sure.
And being able to do that in a creative way and really check for understanding from the students is also something huge in a pharmacist role. So I think through Purdue, my job has given me different skills that a pharmacist would use.
Very transferable skills that I think maybe you wouldn't necessarily think of at first.
Yeah, no,
so
definitely.
That's great.
As far as having Emily as both a fellow SI leader and a TA, it has allowed me to, like you said, get more involved with the older students and helping me through my application process. I know she ran through interview questions with me, read over my essay, kind of gave me tips on different things to be doing. And you really get involved with older students a lot. We also ended up on the same event committee for one of our clubs, and just being able to make pharmacy a community here is a really great thing.
Good, good. So you talked about the application process, and this was very, very recently. You just went through the application for the professional program. Do you want to talk a little bit about that process? What was the application like? What was the interview like? And maybe what advice would you give freshman students or even seniors in high school? What are some things that they could be working on now?
First of all, the application process. A huge thing in the application is definitely exploring the pharmacy career, just being really involved in Purdue and your own community, just showing that you have a care for like what's going on around you. That's huge for the application process. And as well as just work experience and just being able to be involved and just showing that you can be a well-rounded student while you're here. And then you have an essay portion, which is just kind of a general question about why like pharmacy is important to you, why that's what you want to do, and that's where you get to kind of just tell everyone this is why I want to be doing what I want to do, and that's really great. Then the application, after the application and the essay, if you get an interview, that's what I believe has been the most stressful process.
Sure.
You do a small writing portion. You also do a small speaking portion, grammar portion. As far as the interview goes, my biggest advice would just be to stay calm, make sure it's a conversational thing. I think as students, we just, mostly because it's a big deciding factor in what your career path is, we get really freaked out, really worried about what's going to happen. But once you get in there and you sit down, it's really relaxed. They just want to know about you. They want to know why this is for you, what you've been doing to show that like this is what you want to do. And I believe it's really not a stressful process as we all make it out to be. So just staying calm in that situation is probably the best thing to do.
Great. So can you talk about what are some of the admissions factors? A lot of times we talk about 8 puzzle pieces. We talk about the different components of the admissions process. Do you think you can talk about those different pieces, and if need be, your panelists, your co-panelists can help you out?
So, like I said, exploring the career,
Mm-hmm.
having definitely just seeing, like we said, a lot of the reasons we fell in love with pharmacy is just by seeing what it does, how it is when you actually get out into the real setting. So looking into pharmacy is a big one. Volunteering is huge as well. Being able to volunteer within Purdue or the community, just showing that's the kind of person you can be is a huge one. Showing work experience, I think that can show things like punctuality, just being able to be there on time, show that you can make that commitment, and that's what you can do in your free time. 8 is hard. Leadership, oh yeah, that's a huge one. I think that's something, as a pharmacy student, we all just naturally fall into. I think that's why I always forget about it. As a pharmacy student, you'll find you'll get involved in these things, and you'll want to be more involved, and you'll end up in leadership roles that will, like I said, SI helped me learn different things about myself that will help me for pharmacy, and that's a huge thing.
Grades.
Great.
Grades
Sure.
are part of it. They're not everything. Don't freak out that they're everything, but they are part of it. There's also 2 letters of recommendation. Mm-hmm. It can come from just about anywhere, but just some people who will vouch for you and say that why they think that you'll be good in Purdue's pharmacy program. The written essay that she talked about is one of the puzzle pieces, and then the last one is communication skills, which is what you get through the interview that she actually just went through last week. Yeah. So I think we got all 8 of them.
I think you did. So Rachel, kind of following up to that, why do you think the admissions
I think that it's super important that they look at all 8 of these pieces and they don't just look at your GPA or a standardized test, because all of us could have that knowledge and all the knowledge that you can get through pharmacy and through pharmacy school, but it doesn't really matter if you have that knowledge, if you can't apply it, if you can't talk to a 6-year-old who just got diagnosed with asthma and has no clue how to use their inhaler, or to a 60-year-old who just got diagnosed with diabetes and is so overwhelmed. If you can't sit down and talk to those people and really help them, then all the knowledge in the world really isn't worth that much. And also in the volunteerism and the leadership, you're going to be really involved in your community, and you need to have that fire, because sometimes you can get, like many careers, you can get burnt out in pharmacy. But if you have that, really that desire to help other people, to give back to your community, that's what's going to keep you going when there's those nights that it seems like everything's going wrong. And as a pharmacist, you're going to need to be a leader. Oftentimes in the work environment, you don't even work your way up to leadership. You essentially start out as a leader. So having that leadership and that experience in leadership roles is also very vital. So I covered a lot of different, obviously communication comes back to, I think that is so important. And that, like I said, you can have all the knowledge in the world, but if you can't put together all those different puzzle pieces, that doesn't mean you're going to be a good pharmacist.
Yeah. Great. So Sarah, you kind of mentioned briefly as you were talking about the different parts of the application process. You mentioned that you and Emily know each other also through one of the student organizations. Do you want to talk about that? And I think it's really interesting that you guys have become friends even though you're not in the same class, which I think a lot of times people assume that you're pretty much just going to stay friends with the people in your class. And when you get involved, you do get to meet more people. So do you want to talk about the student organization and your involvement?
It's called PSSHP for short, or Purdue Student Society of Health System Pharmacists. And we recently had an event that we hold every year called the Red Dress and Tie event. And I would say I was the newbie on the event committee for this, so it was definitely an interesting process for me. She helped me out here too. She had been on the committee in prior years, and so was able to answer any of my questions. When does this need to be done? What's the time frame for this? Should I decorate this now? Should I email this person? So being able to work with older students has been a really great experience, mostly because that club actually consists of mostly older students, and they can inform you about some of your classes you'll be taking. And it's a kind of hospital role club. They can tell you their experiences. I get to hear about other people's experiences, and I just think it's a really great thing.
Great. Emily, what about you? What has your experience been like in that student organization? Or maybe another student organization too?
Yeah, so I'm involved in PSSHP, and I think one of the great things about it, like Sarah said, it's primarily professional students. So the American Society of Health System Pharmacists is the national organization. And so at each meeting we bring in speakers who are practicing in a hospital or health system setting of some kind to educate us as members about what's going on in the field of pharmacy. But sort of now transitioning, Sarah mentioned that I was involved with the Red Dress and Tie event for a couple of years, and now I'm serving as the president-elect, and next year, for my last year on campus, I'll be the president. So for me, I think it was really neat as a pre-pharm student to experience getting to know the older students and kind of working my way up in the organization, and now sort of from the other side, realizing how important it is to have those younger students and to mentor them and welcome them into the organization, because they're the people that are going to fill our shoes when we're not here anymore.
Sure.
So just sort of making that connection and helping people along has been really fun. And then I'm also involved in Purdue Pharmacy Ambassadors.
Which is why you're all here tonight, right?
Yeah. Yep. So serving on panels like this, when high school students come to campus to visit for a day, giving tours of the pharmacy building, serving on a panel like this, eating lunch at the dining court, all those different types of things that sort of embrace our new future Boilermakers and make them feel at home on campus.
Well, and I think it's just another way to help work on those communication skills. Sarah, you were talking about how SI, just kind of by chance, you weren't expecting it to help you getting up and speaking in front of groups of people. And so I think just by being involved on campus, you work on these parts of the application that sometimes you aren't even expecting. So that's good, and that's part of that learning and growing experience. So again, please feel free to send in any questions that you have, anything that's on your mind. We've got a great panel tonight, and they're happy to talk about anything that you'd like to discuss and learn a little bit more about the pharmacy way and the Boilermaker way. Changing gears, let's talk a little bit about some of the courses that you've taken. Emily, I know you've taken some interesting elective courses in the pharmacy program, and Rachel, I know you've taken some interesting electives outside of the College of Pharmacy. So do you each want to spend a little bit of time talking about those courses that you've taken?
Sure. So last spring I took a course that was called Drug Abuse, Addiction, and Education. And that course was a service learning course, which meant that we spent part of our time in lecture, learning about the science of addiction and which drugs are addictive and why, specifically about the receptors in the brain and things that are affected, so that hardcore science piece. And then we also developed a program for 6th grade students to educate them about those same drugs that we were learning about in a way that 6th graders could understand, and also sort of say no to drugs and promote healthy lifestyles for the 6th graders. And then once we finished developing that program, we actually went and implemented it at a local middle school. So that was really fun, just to be out in the community with that course. In the fall,
and again, it was that teaching. It's that teaching component.
Yes.
So, yeah.
Yes. Then in the fall, I took a course called Therapeutics Case Studies. So after we had finished our normal semester and learned the material in therapeutics, a lot of times it's really important that we keep reviewing that material so that when it's time to take the licensing exam after graduation, we're ready to go. So that course basically just focused on working through patient cases and reminding ourselves, oh yes, we did learn about asthma at one point, and reminding how to use the inhalers and which ones have advantages over the others. And then this spring, I took 2 courses that were electives about over-the-counter medications. And then right now I'm in a course called Motivational Interviewing, which is basically just a fancy word to describe how we communicate with patients. As Rachel said earlier, you can have all the knowledge in the world, and yesterday in class we talked about how there's 6 steps to communicating with a patient, and only one of them is actually telling them about their medication. The rest is listening to their concerns, being able to identify what their concerns are and appropriately addressing those, how to communicate with them and make them feel comfortable to share information with you.
And that's a huge part of being a great healthcare practitioner, is developing those communication skills and developing that trust so that that patient, that customer, health issues. So that's a really important piece. So that's great. I'm glad that you're taking that class. So, Rachel, what about you? Tell us about some of the interesting non-pharmacy electives that you've taken over the years.
I went a little bit of a different round in electives. I've taken some pharmacy electives, but I've also taken advantage of different opportunities within Purdue in a not quite so academically rigorous way, which is actually something I love about Purdue, is that I can, do all kinds of things. So I have taken, over the course of my time here, fairy tales and fables, the history of sports in America, the history of rock and roll, and then last semester I took flower arranging and indoor plant propagation, and it was a wonderful course. You literally, we got to go and we got to arrange flowers, which is a fantastic thing to do when you've just gotten done with, 4 hours of pharmacy classes, and you're really ready for a break, and you can just go and spend 2 hours arranging flowers and doing all sorts of fun things with that.
And you get to take home an arrangement
You get to take them
week,
home.
Right?
It's great. I actually said, Mom, don't you think my tuition money is paying off? I'm getting all these skills about that course. but I really enjoyed all of those courses that I've taken. They may not be, as academically rigorous as some, but they were really good breaks for me, and they let me explore areas that, I really enjoy history, and there are a couple of history courses in there. And believe it or not, in the pharmacy program, there's not a lot of history courses, as it turns out. So it was neat to get to explore my other interests and to kind of have a break from the pharmacy and do something a little bit different and meet students from all different majors and talk to them. I had the guy next to me in flower arranging was in computer science, and sometimes he'd talk about his things, and it made me feel glad I was in pharmacy. So it was just really neat to get to experience all those vast areas that, you might not get to see if you don't venture.
But it also sounds like you had enough time to take these courses as well. I don't think anybody's going to argue that you're pretty busy in pharmacy and there's a lot of classes and it's a pretty heavy workload, but yet you were still able to find some time to squeeze in these elective classes.
Yeah, no, absolutely. Especially as you get further along in the pharmacy curriculum, it frees up more space for you to take these electives. So maybe like my first year of professional school, actually, no, I took history and rock and roll that year too. So there's space. Like you are busy, but these classes, there's space for them, and quite frankly, like they didn't take up, the ones I took at least, didn't take up that much time. And so, it may be busy, but there's always a little bit of room you can squeeze things in. And I actually didn't learn that there's a maximum credit hours at some universities, because here at Purdue I take like 19, 20 just with casually. So I really appreciate that I can go, take as many courses as I want within reason, and that has allowed me to squeeze in, in my spare time, these fun courses.
Good. Sarah, kind of the same topic, but a little bit different, just from the standpoint of knowing that you're still in pre-pharmacy and you're a little bit closer to have graduated from high school. Can you talk a little bit about what the transition was like going from high school to college? Was it a big jump? Did you feel prepared? What was that like?
I would say from high school to first semester of college isn't too bad.
Okay.
You definitely have to change your study habits, what you do daily. It's a little different. You're in a dorm. You don't have like a car usually, so you're trying to figure your way around and try to figure out what's going on. In high school, I feel like you could just look over the study guide before the test, walk right in, and get a great grade. So
common feeling?
Yeah.
Okay.
So college is definitely, it hits you hard at first. I would say learning how to study correctly is the biggest learning experience I've gone through. You will most likely fail one of your first tests. It's most likely going to happen, or for just in general. But it's the learning experience. It's being able to improve how you're learning and be able to take the same course, take the second test in that course, and be able to see your improvement and know your changes you've made from high school is actually working out for you. I think that's been the biggest thing for me. I would say the courses get a lot harder in your second year of pre-pharmacy. That's when it was kind of a reality of, wow, like these are all these science courses I'm taking. This is all the knowledge I'm going to have going into professional school. But as you do your organizations, you have your job, you learn time management, you learn how to just control everything in your life. And I would say that's one of the best things going from high school to college is I feel more, it's kind of silly to say it because I am an adult, but I feel more like an adult after I do things like that. Being able to be aware of your time, when you need to be doing things, is just something really great that you learn from being at school.
Sure. Well, and figuring out when to do the laundry, too. Yeah. I mean, it's just all of those little things. You've got to be a good time manager. Would you say that your time management skills have improved over time?
Oh, most definitely. As you begin to pick up more, you have to learn to, okay, I need to set aside 2 hours for this. I need to make sure. My biggest tool I have is my planner. I use it every day. I don't know what I would do without it. Just knowing what I have to do for that week, being able to just write everything out is the biggest help to me. So I would say going from high school to college, time management is something I got so much better at. And you'll learn. It's definitely a learning process. through, like I said, just through having to do everything and just realizing I have to make time for all these things showed me a way in which I could. It's not impossible.
Okay, great. Does anybody want to talk a little bit about AP courses? Because we're talking to high school seniors who have been admitted, we can't necessarily give them advice of courses that you should take because we're kind of past that. But as far as AP courses that you maybe applied and took that credit and applied it to Purdue, do you have any advice for that? Did you use any of that AP credit? Not use any of it? What was kind of your feeling as far as that goes?
I had quite a bit of AP credit coming in. I had chemistry and biology, which Purdue offered credit for, but I chose to take the courses, specifically the chemistry. I think all pre-pharmacy students are required to take the first semester of chemistry just because it sort of brings all of the pre-pharmacy students together in one place, gives everyone the same foundation, and sets you up really well for the organic sequence. So I didn't use my AP credit for chemistry or biology. I did use it for calculus and for English, and I think for me that just freed up a little bit of extra time that I was able to take some courses in my pre-pharmacy years called Organization, Leadership, and Supervision, so I earned a certificate through that program.
Okay, all right. Rachel or Sarah?
Yeah, I actually have a little bit of a flip side to Emily's. I went to, as I said at the beginning, I'm from the middle of the country in East Central Indiana, and I went to a tiny high school. I graduated in a public school, class of 55. So believe it or not a lot of AP opportunities. I actually added our 4th AP class my junior year of high school. So while it's great to have these AP opportunities and take advantage of them, I'll speak from the other side and say that it's okay if you don't you don't have all these AP courses. We didn't even have physics at all in my high school, so it gives you kind of an idea of where I was coming from. And I would just say to take advantage of what you can. I didn't have a lot of AP, but I took the ones that I could. And, I still did okay. I still had time to take those electives that we talked about and stuff. So while AP is great, don't freak out if you're sitting there and thinking, well, I don't have these, AP courses because, do what you can. But, coming into Purdue, you can still do fine and get good grades if you, haven't had maybe all of the AP courses or rigorous courses in high school.
Okay, that's great. I'm glad that you both talked about kind of maybe the extremes, offering a lot of AP and not always having a lot of AP offerings. So regardless of what high school you're coming from and the amount of offerings that's fine, and really that first semester, that freshman year, we're kind of taking time to get everybody on the same page as far as academics go. So kind of going back to the professional program, therapeutics, I think we hear a lot about that class. What is therapeutics, and can you talk a little bit about some of the things that you learn in that class? And this question is kind of geared towards Rachel and Emily.
So I like to describe therapeutics as the meat and potatoes of pharmacy school. Therapeutics is a class that you think of when you think of someone going to pharmacy school. So it's a class where you learn about the medications and then all the different disease states and the clinical things. So the way therapeutics works, and something that I really like about Purdue is that it does it this way, is we start off on some sort of disease state or some sort of thing we need to treat. And you start by learning the underlying chemistry of it. You learn the anatomy and physiology of what is going on in the body, and then you learn kind of the chemistry of how the drugs work. And that's done by what we call the MCMP professors, which is molecular chemistry. I'm messing this up. Medicinal chemistry, molecular pharmacology. Yeah. And then we have clinical professors come in, and most of them are actually practicing pharmacists. A lot of them are in the Indianapolis area, and they come and they teach us the clinical side immediately after we learn the MCMP side of whatever, usually it's their specialty group, whatever they're practicing in. So then we learn about the patients and about the drugs and how you use them in real life and what you can expect from them and what kind of dosing there is and stuff like that. And so it kind of brings it all together nicely. And then you throw in the lab that I talked about on top of that, and you kind of have the full spectrum of, starting from the bare bones all the way through to talking to patients about and looking through cases, about these disease states. And so therapeutics is a huge class. We meet 6 to 8 hours a week for it. So, it's really the core of what we do. We've done, actually, Emily and I have an exam tomorrow on cardiac arrhythmias and heart failure. So we just are finishing up with a huge cardiology section. We've done hypertension, dyslipidemia, all kinds of blood thinners and things like that. We've spent past, 4 or 5 months probably focusing on cardiovascular things. We've done asthma and diabetes. You can fill in here. Chronic kidney disease.
Yes. Osteoarthritis and rheumatoid arthritis. Some of the, I don't want to say basic topics, but things like fluids and electrolytes and nutrition. A few pediatric topics, although we focus mostly on adult medications.
Obesity, we've done.
I know in P3 year you will do infectious disease. That's a big section.
We're actually starting,
and oncology.
As soon as we're done with our cardiac here, we're going into more of the psych medications, which is going to be, I think about the rest of the semester for us is going to be focused on that. So it's really the whole gamut from nutrition to oncology, that we'll get throughout our curriculum here.
Well, and Rachel, you kind of touched on it, but we've got a lot of faculty down in Indianapolis, and they're practicing pharmacists. So, Emily, can you talk a little bit about how you're going to have a different teacher, a different faculty member teaching on each of these subjects, and so you are not going to have one instructor, one professor throughout the entire semester. You might have 6, 8, 10 people lecturing, and so that's just not something that you're necessarily expecting. But what has that been like for you?
It's definitely a little bit different at the beginning, just getting used to having someone new come in all the time. But you learn to adjust to it, and it's kind of exciting actually to have a new person teaching you every day, because that person is working with patients with diabetes or working with patients with kidney disease on a daily basis, and they're the experts on those medications. They know exactly how they work, what type of side effects that patients are most likely to experience. And I think that they bring in a lot of really neat real-world situations. So after we finished a lecture series, usually we'll have part of a class period or a day in lab where we work on patient cases. And a lot of times these patient cases are true patients that the faculty members have seen in their practice settings. And we get to solve those problems. We get to look at the medication list and decide, this dose is too high, or maybe we should try a different medication. But also working with some of the more human aspects of those patients. A 3 times a day, a medication taken 3 times a day might be the best medication, the most effective medication, but if a patient can't take it 3 times a day or has trouble remembering to take it, that's not the best option for them.
So you're learning the practical aspects of things so much more than what is found in a textbook. Those patient cases really become a very important, crucial part of the curriculum then. Okay, great. Emily, you mentioned that you have got an internship this summer, and I know you haven't had the internship yet, but do you want to talk a little bit about, what made you decide to apply for that? What do you, as of right now, what do you know that you'll be doing on that internship?
So my internship is through the Mayo Clinic, and I decided to apply because one of my fellow officers in PSSHP had participated in the internship last year, and the things that she described the interns doing at the Mayo Clinic sounded really fascinating to me, and made me think, I had several years of experience at Walgreens, and I love the community setting and interacting with the patients, but I wanted to be able to use my clinical knowledge a little bit more now that we're gaining so much of that in therapeutics. So in the outpatient setting at the Mayo Clinic, I'll be basically, from what the internship director told me, is doing as much of the pharmacist role as is possible. So in Minnesota, which is where the Mayo Clinic is located, it's required that all patients are counseled on all of their medications before they leave the pharmacy. So that means that the pharmacist, not a technician, contacts each patient before they leave. And so I'll get to do a lot of speaking with patients about their medications that way. We also get to rotate through several different sites at the Mayo Clinic. Each of their pharmacies has a different specialty. So maybe the one clinic is more focused on the blood thinners and anticoagulation, cardiovascular type things. Another one is focused more on fertility and hormones. So I'll get exposure to a lot of those different practice areas there as well.
Great, that's awesome. I'm really excited for you, and I know you're looking forward to it too.
Yeah.
So we've got a question that has come in. So I think this question is probably going to be geared more towards Emily and Rachel. How does the second year of pre-pharm compare to the first professional year of pharmacy school? Was there a big jump? We talked about the transition from high school to college, but I think this is a great question as well. What is the transition like from pre-pharmacy to professional school?
Go for it.
I think for me, the biggest difference between pre-pharmacy and professional school was that pre-pharmacy is very much science-centered, and there's not a lot of the communication skills and the practical applications that we get in professional school. So for me, I think that was the biggest difference, was just we have these courses now where we're learning how to communicate, and you're really thinking about how is this affecting a specific patient. The first semester of professional school is action-packed. We had like 20 credit hours that first semester, 7 finals in 5 days. But I think by the time you've made it through the application process in your second professional year, or your second pre-pharmacy year, you're ready to take on those time management challenges. Each semester, it feels like I add something new to my schedule and don't necessarily give something up. But I think that you just learn to balance it out and you become more and more efficient.
Okay. Yeah. So is it possible to take 20 credit hours and still find time to sleep and go to a basketball game or whatever the case may be? Because 20 credit hours sounds like a lot.
It is a lot, but it is possible to do all those things. Like Emily said, that first semester is action-packed, but I still, I don't think I missed a single basketball game. You really do. As Sarah was saying, it's all about time management. And the great thing is, by the time you get to that first year of professional school, you've been through the pre-pharmacy, like she was talking about. It really steps up. Your first year of pre-pharmacy isn't quite as hard academically, so it lets you kind of get those things in line and figure out about the studying without like totally killing you while you're doing it. So it is a nice stepping stone that you get your time management in line, and you just kind of have to learn about yourself, how to prioritize. So for me, I told myself that, for better or worse, that I wasn't going to let academics rule my life. And it's something that I stood by. I kind of started it when I started the professional school. Sometimes I have to do a little bit of a self-check and say, hey, you know what, Rachel, there's more than academics. I'm not going to let it rule my life. And so sometimes, I may have an exam the next day. I just take my notes to the basketball game with me. And, I can still balance. And I'm still passing. I'm still doing fine academically. As long as you prioritize that, this is what I want to do. And these are the things, that I want to get done and that I want to experience. Because college is so much more than just academics. While they're vitally important, there are so many different things to experience. So it's all about getting your priorities and making sure that you're getting done what you need to get done so that you can, do the fun things like go to the basketball games or, hang out with friends or whatever.
Good. So making friends, important part of starting in any college or university and finding a sense of community. What were some of the best places that you kind of were able to make some friends right away? And Sarah, maybe this is the best question for you, since you're the youngest student on the panel.
I would say orientation here at Purdue is great at doing that. I still hang out with half of my orientation group. I want to say once a week. I see them all the time.
Wow.
I know some groups don't get to connect like that, but I know it works out a lot, and that is definitely where I made a lot of my friends. I was also in the learning community for pre-pharmacy, and I am roommates with someone I met in the pre-pharmacy learning community now, and my two neighbors were in the learning community, and we made sure we ended up next to each other. So being able to, I wouldn't even say it was based on like, oh, we academically all do this together. It was just more like, oh, we're all in the same situation. Really being able to be friends with people from your orientation group that are in different majors is really nice to get out of the pharmacy role, but it's great to have friends in pharmacy. So if you're having problems or if you just need to talk to someone else who realizes how hard it can be sometimes, that's also a great place to do it. And I would say through my organizations and my work experience that I've made a lot of friends here. I'm in Habitat for Humanity, the Purdue Student Society of Health System Pharmacists. I feel like I can walk around on campus and see multiple people all the time that I know, be able to stop and have a conversation with them. So getting involved has really allowed me to expand the types and like how many friends that I have.
Great. All right. Does anybody else have anything to add to that?
And she kind of hit on this. And really at Purdue, I think we have about the largest voluntary dorm living. So I've heard that statistic or somewhere up there. In that our dorms, it isn't mandatory to live in our dorms, but a huge percentage of the freshmen do in fact live in dorms. And I would really encourage that your freshman year. And I moved out of the dorms into an apartment my sophomore year. But I really appreciate that I lived in the dorms my freshman year because it throws you in an environment where everyone else is in about the same boat and doesn't really know anybody. And it also is nice that, I lived on the 7th floor. And I had a bunch of friends on the 5th floor. And I could go at 2 in the morning and go down 2 flights of steps and hang out with them. And I didn't have to worry about, anything or worry about walking, in the cold at 2 in the morning by myself because I was just going down 2 flights of steps. So that was a really nice thing about living in the dorm systems is it allows you to meet people and to really be close to people when you're first starting out.
Okay, great. Again, if you've got any questions, please feel free to send those in. We've got a great panel tonight, and they're happy to answer any questions that we have or that you might have. Let's see here. Does anybody want to talk about some of the things that you do for fun outside of class? Talked a little bit about going to the basketball games, Rachel, but anybody else, anything fun that you like to do?
Mine's actually kind of sad. Well, not sad in a bad way, but me and my roommate actually will play Wii a lot. It's like
Sure.
It's being able to separate yourself just academically and getting some time for yourself. It doesn't even have to be anything major. You don't have to go to the basketball game. Sit in your room, watch some TV, play Mario Kart. Just doing like the little things for yourself, or even just to take a study break is definitely something that's great. Or I know a lot of my clubs even offer like outside club activities that you can attend that also get you out of your dorm, get you out of studying. And there's really, at Purdue, there's not a lack of things that you can do to stop academics for a while.
Okay.
I would also encourage people to get involved in clubs that aren't necessarily in pharmacy. Well, I think it's great to get in clubs that are in pharmacy, and it can really help you learn more about the profession and meet people. It's also really neat that we go to Purdue, which is a school where there are like 1,000 different clubs and only a few, there's a few in pharmacy, but there's so many. Like there's a free food club where they just inform each other in the club where when they see free food, like on the Memorial Mall, they send out like this mass email, like free food here. I'm not in that one, but there's just so many different things you can be in. And it can be a break from the academics to be involved in a club that is something entirely different. And it could be something, like Habitat for Humanity where you're volunteering, or it could be something that's, this, Adopt a Grandmother Club where you go and you adopt a grandparent and you do cool things with people in the community who, are looking for adopting a grandchild, to a degree, adopting a grandchild. So I would encourage anybody to, really broaden their, involvement and to get involved in really whatever you want. Or go to basketball games. I don't want to push it too hard, but basketball games. My voice is still half gone from Tuesday, so basketball games. But you don't have to.
So we are just about coming up on the end of our hour and our time together. As we wrap up, does anybody have any words of advice, any last words of wisdom, thinking back to when you were a senior in high school? Was there anything that you wish you knew or anything that you would like to go back and tell yourself back in those days?
I would say that it's okay to not be sure. It's okay to not be sure about what you want to do. It's okay, to not, because everyone and their grandmother is probably asking you, especially if you're a senior right now, where are you going to college? What major are you going to do? What are you going to do with that when you graduate? And as someone who wasn't sure, it feels like, you need to know. And, I would encourage you that it's okay to not be sure. It's even okay at my point, like not to be sure what I want to do within pharmacy still. There's so many different opportunities to explore things and to learn more about yourself after you get to college. If you don't know right now, don't feel like you're the only one who doesn't know, and don't feel like you have to know exactly what you want to do, because you don't. And if you get to Purdue and you start in pharmacy and you realize that, hey, maybe this isn't for me, that's perfectly fine. Find something that is. There's a lot of exploratory studies and different opportunities to figure out what might be for you. So don't feel like you have to know, even though everyone seems like they're expecting you to.
Okay, good, thank you. Emily or Sarah, any last words of advice?
I think I would just add that we listed off earlier the 8 pieces of the application process, and I know that as a senior in high school I felt like, oh my gosh, my to-do list is huge, and I have 2 years, a little less than 2 years even, before the application process and everything, and it feels like there's so much to be done in so little time, and there is a lot to be done, but I would just encourage you to realize that once you get onto campus, it becomes really easy to just make sure that, okay, I'm going to go to a call out for a club. And if you decide you like it, you can stick with it. If you don't like it, there will always be a call out again next week. So you can try a different club. So I think just adding things one at a time, making sure that you're able to manage each thing on its own. Try not to overwhelm yourself with all 8 things all at once.
Okay, good. And Sarah?
I would say something my mom always brings up is, well, first of all, pharmacy, it kind of can feel like a comparative community as you're moving through your pharmacy education, I suppose. And something I always like to keep in mind, as long as you're doing the best that you can do, that is all that matters. Doing the best, getting the best shadowing experiences you can get, that's all that matters. Doing the best academically. As long as you are continually improving, I think that's just the best thing to keep in mind. Because really, if you, obviously these older students, other people in my clubs, everyone around here is there for you. And if you just realize that you're doing the best you can do, you're going to utilize your resources, that's really the best thing to do.
Okay. And so we've got one last question, Sarah, this might be the best for you. How did you prepare best for your first year of college in the summer? In that summer before, what did you do to make sure that you were going to be most prepared?
I would say exploring the career a little bit is definitely a great thing to do. It's really not as challenging as we all kind of make it seem to get out into the career. If you go to a local pharmacy, pharmacists are so willing to be able to let you come and watch what they do. So if you can just get out into your community and really see kind of what pharmacy is about, and even just get into your community and see what volunteering is like, what being part of your community is like. I wouldn't worry too much academically wise. I don't think I brushed up on anything before I came to Purdue. Purdue really prepares you with your general courses. I didn't feel like I was drowning in schoolwork when I first got here. I would say just preparing yourself for a community type thing and really starting to explore what the career is like.
Okay, great. All right, well, ladies, thank you so much for participating in this panel tonight. If you have any other questions as we wrap up tonight, feel free to send an email to pharmacy-oss@purdue.edu. Be happy to answer your questions tomorrow or anytime in the future. Again, on behalf of Emily and Rachel and Sarah, I'm Holly Keckler, and thank you so much for joining us tonight. Have a good night.